Hi everyone, welcome to our poster presentation for trends in mortality of cardiovascular diseases in patients with colorectal cancer. Over the past few decades, oncological therapies have significantly improved survival for colorectal cancer patients. However, among survivors, non-cancer related complications such as mortality due to cardiovascular disease are becoming increasingly important. Among these, hypertension, ischemic heart disease, and heart failure stand out as the leading contributors. Our study is set out to answer a simple but an important question: what are the trends in cardiovascular related mortality among colorectal cancer patients in the United States? And beyond that, we want to see how these patterns vary across age, gender, race, and geographic regions. Therefore, we used the CDC Wonder database covering data from 1999 through 2020. We extracted both crude and age-adjusted mortality rates and identified temporal trends using the joint point regression analysis. Now let's move on to the results. Between 1999 and 2020, there were over 352,000 cardiovascular-related deaths in colorectal cancer patients. Overall mortality rates dropped from almost 7 deaths per 100,000 in 1999 down to fewer than 4 deaths in 2020. A major chunk of this decline was seen between 2002 and 2016. Let's break it down by subtypes. For hypertension, our data revealed that it was responsible for more than 100,000 deaths. Unlike the others, its mortality rate actually increased, rising from less than 1 to nearly 1.5 deaths per 100,000 by 2020. For ischemic heart disease, our analysis revealed about 100,000 deaths. The trend was encouraging, a steady decline across the study years, making it a less dominant cause over time. For heart failure, our data showed about 53,000 deaths. This also declined until 2015. However, it has shown an upward trend since then. When looking at demographics, our data, when stratified by race and gender, revealed males and non-Hispanic Black individuals had the highest mortality rates. Moreover, when stratified by region and age, the Northeast region and people above 85 years of age showed the highest mortality. To summarize, deaths from ischemic heart disease and heart failure have declined. However, hypertension has emerged as the leading contributor to cardiovascular-related mortality in colorectal cancer patients. This highlights the urgent need for integrated cardio-oncology strategies with a special focus on hypertension control, regional disparities, and protecting high-risk groups such as older adults, males, and non-Hispanic Black populations. Thank you for your time. We look forward to your potential questions and discussion on this presentation.